with, I was going to say with the Well Fit and Fed show. That's not a show. It's the Junk You Should Know show, production of Well Fit and Fed. And I'm so excited that you are here today. With me today, I've got Reid Kuether, who is a very good friend, but also a professional colleague. And we are in his office, Phoenix Physical Therapy in Issaquah, and we are going to be talking about outliers today. And what we mean by that is all the things you can do to stand you apart from the wheelchairs and walkers later in life. And we've got some great content for you today. But first, I'm going to tell you about last week's show was on protein powder and why yours is garbage. And you should go back and watch that show. We've had all sorts of great comments and discussion and people putting up their protein powders and asking for evaluations. So go check that show out. And the week before, we had Dr. Michael Bruce, the sleep doctor. Hi, Cynthia, the sleep doctor. And he was fantastic as well. So we have just been having some incredible quality interviews on the show, and I'm so excited. That is going to continue today with Reid. Quickly, before I introduce Reid, I'm just going to do a quick sponsor from the Change Cave, 12-module online Learning Institute incredible membership program. I'm going to put the link below. And just so you know, pricing is changing in September. So if you are tired of doing this wellness thing alone, you've been struggling to lose weight, you've been struggling to implement a fitness program, then the Change Cave is for you. It's simple, it's $23.99 a month, cancelable at any time. So do take advantage of that, and the link will be placed before. So without further ado, I've got Reid with me. Reid, welcome to the show.
Thank you for having me.
And I'm very excited. We are going to go over some discussion today, some exercises. So this is going to be incredibly power-packed. Now, Reid, I want you to tell me a little bit about your background. If you could just scoot up here just a little bit for me. Tell me a little bit about your background, schooling, how you came to land here in this beautiful office.
It's gorgeous.
It is gorgeous.
Yes. So I've been a physical therapist for 20 years. I graduated from the University of Puget Sound in 1998. So just in May, past 20 years. I started my career with a clinic affiliated with the Seattle Seahawks and in Kirkland, and then moved into Issaquah in 1999. And sometime after that, met you working with mutual patients over time as I was developing the program for the group of orthopedic surgeons here in Issaquah. And then about 3 years ago, moved in here to this great building with a great view to serve the needs of Issaquah, where I really feel like I have grounded roots with patients here. So
it's great.
Phoenix is 3 years old. I have myself here, and then Julie Barron, who is a certified strength and conditioning coach. And then we just brought on another therapist, Katie McCurry. So there's three of us here.
That's fantastic. I've worked with Reid for almost 20 years, and we have shared patients year after year after year, and I've been so impressed with the results. And he is by far an expert on some of the content we're going to be discussing today. And so we are using the word outlier, and people might not quite know what we mean by that. And so what I think I want to ask first is, like, what are the quality of life elements that are so important later in life that we should be working on now?
I think it's twofold. I think it's a balance of function and a function of balance.
Oh.
They sound the same.
Yeah.
But I think balance is really key when it comes to our later years. We know that risk of falling is a big indicator for deterioration of quality of life. With a initial fall, our risk of falling increases because of fear of falling. So we have to be able to work on our balance and know where our body is in space and be able to control that. The second thing is, I think, the balance of function. And by that, I mean flexibility, anterior and posterior chain, making sure that the flexibility on the front side of our body matches that on the back side, so we can land in symmetry, as well as the flexibility, the balance of strength when it comes to the balance of our push muscles and our pull muscles. Okay,
so let me just recap on that. So it's a balance of flexion and extension, or forward bending and backward bending, our ability to do both, right? The thing I love that you said was, what happens later in life is it's a catch-22, because someone might have a spill or fall, then they're terrified of further spills and falls. So then there's this fear avoidance behavior where they're grabbing onto everything and not practicing their balance, which then further declines. So continuing to intentionally work on balance and work on strength to support everything that we're talking about here. Okay, great. And so why is, we talk about flexibility and flexion, flexibility and extension. Why is flexion always so much easier?
It is. I think part of that is our world is in front of us, right? We are constantly looking forward into a computer screen, our dinner plate, the windshield of our car. We're always looking forward to see what things are in front of us, right? And if we flip back to our early days as infants, it's easy to get our feet to our mouth and our hands to our mouth. And part of that is to eat. I mean, it's when somebody comes in after an elbow fracture, let's say, it's really difficult to get elbow extension, but people will find a way to get food to the mouth. So flexion becomes pretty easy. And you think about those new parents with those infants, right? How much they are encouraged to do tummy time. to make sure that we work on those extensor muscles so that that baby then can stand to fight against gravity. So the extension, it becomes a difficult thing, but it has to be somewhat intentional.
Yeah, I love that. And in chiropractic, we do the same thing. We really encourage that tummy time to accentuate that lumbar and cervical curve. And what do you notice, particularly in elderly men, is, I wish I could do the demonstration, but it's butt under, no curve in the back, and they're leading with their pelvis across the, and it's because they've lost that extension. They've lost that ability to have a nice, flexible lumbar curve. And then there's a cascade that happens there.
That's true.
Yeah, absolutely. Okay, so postural issues. With the flexion and extension and the imbalance between those, and with everything we do in front of us, and a lot of this action, posture has become an epidemic problem, right? And people don't understand. Like I've been to the mall and literally almost gone and broken up a group of 14-year-old girls and taught them all how to stand up straight, because they're late, and they're afraid of their height, they're afraid of their development, they're like this, and so it starts early. And so tell me a little bit about, why do we even care? What's the big deal about posture?
Yeah, well, I think that poor posture that we see now as an ICD-10 code text neck, right? That's
an actual diagnosis
now. Yes, unfortunately, and we all suffer. But so I think posture can affect us from head to toe. I mean, it can really affect headaches. If we're starting to slump down, we don't want to look at the ground unless you're getting that balance issue where you have a fear of falling. You want to look to the ground right at the next step ahead of you. But most of us will want to look up. So it really shortens the muscle at the back of the neck, as you know.
Yes.
Certainly changes the position of our shoulder blade, which is the socket of our ball and socket joint of the shoulder. So our impingement risk goes up because that outlet of our muscles is decreased. Certainly, of course, lower back pain. But we tend to kind of fall into this internal rotation sort of pattern, which when you're walking can put increased stress to your plantar fascia when you push off, which can lead to plantar fasciitis. I mean, really top to toe.
Top to bottom. There's a massive chain of events that happen there. And then from a chiropractic standpoint, one of the things that we look at a lot, and I know you guys do too, is the second our head is out here, because we're like this and we have to tilt up, you're getting a neural impingement and subsequent cognitive effect. There's even been connection to dementia and different changes that are going to really affect you later in life and affect your independence and your ability to stay away from some of the classic things that seem to happen as we age that we don't want to. Right. So the posture thing. So how do we become an outlier? How do we escape what seems to be this inevitable decline of balance and strength, and we end up forward bended and all of that? So how do we avoid that? Reid?
Yes, how do we do that? Well, I think the biggest thing is to fight against gravity through exercise, right? Gravity is free, and it's always going to be pushing down on us. We've got to be able to work against that force through exercise intentionally, again, through the extensor muscles. So it needs to be smart exercises. I think, working that posterior chain, again, you see even young kids going into the gym, and the things we see in the mirror are super fun to work because we get to see them. But when do you think about your shoulder blade retractors, right?
Yes.
Most people don't even know how to fire those muscles because they've never seen the muscle in action.
Guilty. When I had a shoulder problem, it was one of the first times I went to Reid as a patient, and I tried to, and I was working out at the time, and he tried to get me to fire those shoulder blades to, everyone can kind of squeeze together somehow, but if you're firing the right muscles, it's a very different feel.
It is.
And I just repeat, I love, because when you and I were briefing before this, you talked about everyone looking in the mirror and working those muscles. I'd never thought about that before, but that is classic. People work biceps, chest, quads, and they forget everything at the back.
It's true. Yeah, it's very one planar, right?
Yes.
Yeah.
And so then we get overdeveloped, and it's a big issue for sure. Tracy, good to see you. Glad you could join us. Okay, so I think we have some exercises.
Yeah, so I think anything that works that posterior chain, even just pulling a band apart, like to work those shoulder retractors, or leaning over a bench and working your arms in those directions.
So that opening,
right?
Yeah.
Or your glutes, working your glutes and hip extension with your feet up on a couch cushion, lifting your hips up, those sorts of things, just to work that posterior chain. Okay, that makes sense. So an awareness that we even have a posterior chain, and that you understand that a lot of that has to do with our postural muscles. And then spending time intentionally strengthening them. Yes.
For sure. Okay, that's awesome.
And the other piece of that, Heather, is not just exercising, but making sure that we're doing it smart in terms of having the appropriate rest times. You want to avoid that New Year's resolution, like sprinting from the gate. You want to make sure that you're giving yourself relative rest from an exercise. It can be active rest, where you just work another muscle group while you're resting. One muscle group, it can be relative rest, where you're doing something totally different where you're cross-training, maybe swimming one day, running the next day.
I like that.
And then there's true rest. When there's injury or there's symptoms that are giving you some feedback, I think true rest is an important thing to make sure you take a day off.
I think that's important too, because as we're starting to tell you to work new and different muscles you probably haven't identified before, the tendency is to go after it gangbusters, set ourselves up for injury, and then you're out, and then we're back to square one. And so do it slowly, very deliberately, and make sure you're taking the proper breaks for sure. And I like how you say there's different kinds of rest. Rest doesn't mean take 2 days off. It means work a different muscle group, do a different type of exercise like swimming instead of cycling on the bike. And then true rest, if you are feeling really sore and you just really feel like you need a recovery day, just some gentle stretching on the floor. So something like that. I love that. Okay, so we know there is a big progress killer for patients. One of them is that they're not doing the exercise correctly, they get injured, and then they stop doing what they're doing, and that's a progress killer. But there's another one. What would you suggest is probably the biggest
Well, I think
issue?
Consistency, right?
Oh.
The ability to maintain the level of progress that you're doing and to be consistent with the program in which you're putting yourself through, right? So that motivation factor.
Yeah. So with consistency, can you help us? Because I think a lot of people know I'm not consistent with my workout. Do you have some tips or tricks for that?
I think there's a few. I think if we set periodic goals, I think whether it's weekly, quarterly, yearly, just have something that you're shooting for. I was hiking the other day and there was a gal their shirt said "sweating for the wedding." And I
oh
think
my gosh,
really,
I love it.
Really easy when there's big moments, right?
Yeah.
But when there's not this big event that we have coming up that we really want to shoot for, but maybe it's the next 5K race, or maybe it's the next, fundraising event that you want to participate with your kids, or, just having something on the calendar that keeps you motivated to have some sort of a goal. Right?
I think that's great.
So
that's really good.
I think accountability is important, whether that's a workout buddy. I think for some reason we have a hard time canceling on someone else, but we can cancel on ourselves.
That is so true.
Isn't it?
Yeah.
We should be more kind of honest to ourselves instead of somebody else.
Yes.
But having somebody else in the mix just makes us a little more accountable to show up at the gym at 6 in the morning if you know someone else is going to be there. It can be just a text group, or these Fitbit or activity tracker groups that really motivate people. Well, Susie has 10,000 steps, so I do have a friend who at 10 to 12 might be out in her driveway doing laps just to get those steps above Susie because she can't lose, right?
I love that.
So,
I was on Strava, and some stranger named Britta took my crown, and I got so PO'd. I went out and ran this mountain in a much faster time than I'd ever done and knocked that girl off the mountaintop, and I got my crown back.
Right.
So
whatever motivates.
Motivation can be incredible. So Strava is a great one. MyFitnessPal is a great one. Your Fitbit is great. There are groups on Facebook. So if you don't have a buddy in your life, then there's no excuses anymore, because there are lots of opportunities out there to help with that. I also had a gym friend. We didn't like to do the same workout or anything, but it was literally a high five at the front door and a high five on the way out. But you better be there for the high five. Yeah, that's right. You better be there. Okay, what else?
Well, I think again, we talked about proper progression to make sure that you're not fading out, but there's a 10% rule where, if you're, say, running 5 miles, you don't the next day run 10. If you haven't trained for that, you kind of increase your mileage or your intensity by about 10%.
10%. Okay. And is that true so I definitely know that for running. Is that true kind of across the board with weight? Like if I want to increase my weights, is it about 10%?
I think that's a safe thing to do, right?
Okay,
and, weight training
Did you say 10% per week?
Well, it can be 10%. Like if you, let's say, are weight training, it can be 10% per muscle group. Okay. So as long as you're able to recover from the previous exercise.
Yes.
Right?
Okay.
The recovery part's the important piece too.
Yeah.
So 10% increasing it. And with running, there's an interesting model in terms of the kind of amping up and then coming back down. So it may not be every time increasing, but again, those are relative rest days. It may not be activity, it can be just the intensity in which you're doing it.
Yeah. And I think that's a good point too, is with running, varying your distance, varying your intensity, varying your surface, all so important, because running is probably one of your biggest injuries you see in here, right?
Yep, variability. And the people that hit the same path and the same pavement with the same shoes every single day, at some point there's going to be some breakdown, whether it's the equipment and we don't notice it, and then our body tends to break down in response to that. Same thing with our car, right? Yeah. If you're riding those 50,000 mile tires at 65,000, something's going to give way. Yeah,
and that's a great point. And I know one of the things that you do really well is foot evaluations, shoe recommendations, and a lot of things like that. And so if you don't have someone in your life like that, find somebody. Reid's a great example, but I'm sure if you are not in the Issaquah area, there are others, physical therapists who are well versed in that. He helped me. I was in completely the wrong shoe and didn't know it, and that absolutely helped my fitness and exercise avoid knee pain and all that stuff. So that's
a super important
really great.
piece.
What else do we have?
Well, so I think, the other piece with consistency is just as long as you keep moving, you can keep moving, right?
Okay.
And I want to add the word well to that. As long as you keep moving well, you can keep moving.
Okay, I love that. I'm going to say it again. As long as you keep moving well, you can keep moving, because what we're talking about here is being an outlier later in life. And the truth is that super fit 70-year-old that you see in a 5K didn't start yesterday.
No.
Okay.
No.
And so the idea is start with the future in mind.
Yeah. Think about your future self. And it is the true use it or lose it mentality. We see, elderly Asian women doing a deep squat for hours on end because they've done it every day of their life.
Yes.
Right? And you look at your infants again and toddlers, they can play in the squat position for a very long time. At what point do we strip that ability away?
Yeah.
Lifestyle gets in the way, of course, sitting in desks in school, and then, the whole sitting at a desk at work, and the way that we progress in our lifestyle. But if we were able to squat down every day in the morning, first thing every morning, if we did that, every single day, you'd be able to do that, right?
Yeah.
And when you stop noticing the ability to do that, that's when you start to change the system, right? You go and you seek help or do something different.
Yeah.
I was looking up the statistics for the 2018 Boston Marathon.
Okay.
And almost 30% of the people that finished the race were over the age of 70.
Oh my gosh.
And 7 were over the age of 80.
Oh, wow.
So how do we become that person?
Yeah.
Right? So, and there's a lot of people who are competing in those sorts of things, but they're winning because nobody else is competing against them.
Yes.
You want to have that cohort continue to increase. I tried to look up the race prior to see if the statistics had changed, then it wasn't out.
It was available.
But yeah, I think it's a great thing for us to look at. If 30% can do it, why not me? And how do I want to get there? Right.
So I think it's good. You talked about the squat, and a lot of people, seriously, if you took 20 people on a train platform and told them all to squat, probably 4 could do it. I don't even know if it'd be that many. Because when we're sitting, we're not getting that full flexion into the hips and all of that. So there are some basic moves that are going to carry us into old age. Squat is one of them. What are some other functional moves that you recommend making sure you are exercising into?
Yeah, I think one of the things that I tend to see with patients that are lacking is side-to-side movement. I think we tend to do a lot of things forward and backward, and take the marathon runner who might be really great at a long distance run straight forward, but try to have them play soccer and plant and cut and they fall over. Okay. Because they haven't trained that lateral motion. So making sure that we're doing things side to side to train the side of our hips, I think, is important too. Of course, anything core. Yeah. Because all motion has to come through our core. To create power. Yes. Super important.
Yeah. And I things like I always like the example of yanking whenever I'm on the plane and I'm seeing somebody reach overhead, and there's just a point that it seems like people stop even trying, and I think so no matter what age you are, continuing to try to reach and to do your side to side and to squat, push, pull, lunge, I think. Okay. So those are some key basic functional elements.
And we see it with patients with frozen shoulder, right? It's that classic, all of a sudden I couldn't move my shoulder, right? So being able to make sure, and part of that, the first phase of frozen shoulder is just pain. It limits the desire to move the shoulder, so then all of a sudden you can't move the shoulder. Right? So don't let pain get in your way. But the initial point of pain, within reason, is good reason to seek help.
Yeah, absolutely. And knowing when to, so that's a great one. Don't let it just linger, because even within a 24-hour period already, little teeny adhesions are being placed down and limiting your range of motion further and that sort of thing. Get evaluated quickly. I mean, worst case, they say you're fine, go home and just sleep it off. But more often it's going to be, well, we could be doing these exercises and give you some guidance to make sure you regain that full range of motion back again. And I think that's true for any injury. I was stunned in my practice how often I would have someone come in either post-surgical or post-orthopedic big injury, and they never got sent to physical therapy. And I would just be like, are you kidding? Because I can't tell if I have full range of motion back. You can, but there are micro movements that Reid or other PTs can assess that I don't even know are missing. And then already I'm at a deficit going into my 6th, 7th decade, because now scar tissue is going to set up and all of that. So I think that's really, really super key.
I think there's a difference between compensation and cheating. So, and I'll tease patients in the clinic all the time, stop cheating. But really, the body wants to do what you're asking it to do. And one of the greatest examples was a gal I saw after a motor vehicle accident, had whiplash, significant pain in the neck. And I'm looking at her range of motion, assessing her mobility. And I said, I want you to turn to the right. And she said this. So I'm like, she did exactly what I asked her to do, but there was no motion because, you know, so we find ways to do things to satisfy the goal that we have.
Yeah.
And we create different patterns to get there. And we don't always know it, like you say.
We often don't know it. Yeah, because I think we're also good at just kind of, are as good as we are at physically compensating, we kind of mentally, emotionally compensate as well and live in the world denial. I like, my favorite is sort of similar. It's like tilt your ear to your shoulder and they're like this, or they're like this. That's not ear to there.
I did what you asked me to do.
I did what you asked me to do. My favorite. So let me think. What else have we got? So we got, as long as we keep moving well, you can keep moving.
Absolutely.
So that's really important. And hi, Laura. Dr. Laura's on. She's amazing. She's all into this. We're going to be talking about this with Dr. Laura on Tuesday, a lot about functional fitness and movement. So this is great. Okay. So if a patient or a viewer, somebody out there in either live world or replay world they're like, oh yeah, I either have an old injury or I have a current injury, what are their first steps?
I think certainly seeking evaluation to kind of get your movement pattern assessed. Again, what you think you may be doing, you may or may not be doing. And have a second set of eyes that's really trained to see those motion patterns is, I think, super important.
Yeah.
To be able to give you tips on where you need to address your attention. I think what we like to do here at Phoenix is to connect symptom to cause. And you don't just treat symptoms by icing an ankle that hurts or, you know, plantar fasciitis. What's driving that pain? Where is the weakness in the system?
Yeah.
Because the reality is your system is designed to produce the results that you're getting.
Yes.
And if you keep doing what you're doing, you're going to continue to get the results. And if that's pain, that will continue.
I love that.
So we have to change the system to change the result.
That's great.
And I think, you know, as physical therapists and chiropractors, we look at those movement patterns and we can assess where we need to make those changes. And oftentimes not where it's sore, it's elsewhere. And to convince a patient of that, through education, I think is important. So they have that empowerment to move forward and do the right thing.
Yeah, and a personal example is some chronic knee stuff I had a while back, and you identified it was glute medius. It was up in my butt, not in my knee. And so it does take a professional eye to objectively look at you. And so one thing I will say though, you know, love to all the PTs out there, but not all PTs work the same. And so in physical therapy, I think you have to shop to find someone who's wellness minded and really interested in looking at causation. And so be sure you're interviewing your physical therapist well to know that they're not just looking at the diagnosis that the doctor sent over and going to town, but they're actually really seeking out to find out, how did you get here? What have you been doing before this? You know, and really doing the work to get to the cause of the problem and deal with that. So that's really key.
Yep.
Now, before we went live, you told me you do some evaluations here in the office that are complimentary. Can you explain what that is?
Yeah, sometimes we'll get patients that call and they say, I don't really know if physical therapy is what I need to do, but you know, I've got this pain. And so we call it a sports eval here in the clinic, and we'll do a 45-minute assessment, kind of listen to their symptoms, assess their system as far as their motion, look at their shoe wear, if they're a runner, you know, whatever variable we can affect change. Yeah. We'll look at those variables and say, well, maybe it is therapy. Maybe here's the plan that we would put together for you if you chose to go this route. Or maybe it's something more significant that then needs to have more diagnostic workup, where we might refer to an orthopedic surgeon or you know, work within our network of professionals to say, well, this is really where you need to fall. Or maybe it's, you know, multiple spokes of that wheel.
Yeah.
So,
yeah, I'm such a big advocate in talking about creating your own personal improvement team. And big part of that for me is really regular physical therapy, you know, for all the little, I'm super, super active. And so I often need stuff. And so it's not always because I've injured something, but it may be because I'm feeling like something isn't moving right, or I'm losing flexibility somewhere. And it might be that I'm thinking it's a compensating pattern. And so I always work physical therapy into regular chiropractic care as well. And so don't just wait until you've, you know, grade 3 sprained an ankle. Make sure you're addressing that before that ankle rolls and there was a stability problem before and all that. So I think that's really important. So Reid is at Phoenix Physical Therapy and Personal Wellness. Love the full title of the business. It does matter.
It does matter.
Wellness matters. And we've been talking about outliers today. We've been talking about how to stand apart from the walkers in the wheelchair. And just to wrap up, we talked about maintaining and intentionally performing functional movements on an almost daily basis so that we can preserve those later. What was the move well one? What did you say?
As long as you move well, you can keep moving.
As long as you move well, you can keep moving. I love that. And I think also just creating a lot of variety of types of movements. So what you did yesterday, you do a little differently today to help prevent injury, to keep you interested, to make sure you're not overworking a muscle group. And I think that's key. What else what's a couple main highlights? What else? Did I miss anything?
Well, I do like the system is designed to produce the results you're getting. So if you're happy with what you're getting, carry on.
System is designed to produce the results you're getting. So if you are happy, keep doing what you're doing. If you're not happy, something needs to change. Awesome.
Yes.
Excellent.
I also think there's, preventative care is also important too. We think of physical therapy as injury care.
We do. A lot of people do. Yeah.
If you're looking forward to, I'm going to start running, I've never run before, get an assessment and make sure that you're doing it the right way.
That's a great example. If you're starting a new activity, you want to do a Tough Mudder, or you're going to do a 5K, or you're taking up golf and you've never done it before, there are some mechanics that are really important to understand and know, and a basic evaluation would be really, really helpful to get you started on the right foot.
Correct.
Yes.
No pun intended.
No pun intended. Reid, thank you so much for being with me. So again, we're at Phoenix Physical Therapy and Personal Wellness in Issaquah. Upstairs, what's the name of the building again?
It's Issaquah Medical Building.
It's where the crazy construction is happening right now. You'll know where that is, the cut through. And do check in with Reid. He's a wealth of information. He is highly credentialed and would love to speak with you. So do give us a call. And everyone who's watching live, thank you so much for being here. I sure appreciate it. And in the replay, please check the comments below. We'll have lots of discussion going on, so that'll just kind of be the post-show place, and Reid and I will be there dialoguing with folks as they post their questions, comments, and whatever else. So do share this with friends. If you have anybody who either has an injury, had an injury, starting a new sport, or anything, please share it to them so they can benefit from the information on today's show. So I'm Dr. Heather with the Junk You Should Know Show. Thank you, Reid. And we will check in again with you guys next week. Have a great weekend.
Thanks.